Do you know, according to the CDC, 34.2 million people, or 10.5% of the US population, had diabetes? This means every 1 in 10 people you know have diabetes. What is more alarming is that statistics have shown that 1 in every 3 American adults have pre-diabetes. In this video, let me tell you what is diabetes, how do doctors diagnose diabetes, and how do you suspect yourself having diabetes based on some common symptoms. Welcome to Dr. Says. Type 2 diabetes is by far the most common type of diabetes in adults and is characterized by hyperglycemia. Glycemia being sugar in your blood, and hyper meaning unusually high. You may ask, how high is high? We doctors diagnose diabetes in 3 ways. First, if your blood sugar after an overnight 8-hour fasting level is more or equal to 126 mg per deciliter or 7 millimole per liter. Second, we will ask our patients to perform an oral glucose tolerance test, whereby we will force them to drink a 75 gram of glucose dissolved in water and measure their blood sugar levels after 2 hours. If the level is more or equals to 200 mg per deciliter or 11.1 millimole per liter, congratulations, you have diabetes. The last method and the easiest method is to measure your blood HbA1c levels without you fasting or drinking any sugary drink, and you are considered a diabetic if the levels are more or equals than 6.5%. HbA1c is known as glycated hemoglobin. It is blood sugar that is bounded to your red blood cells. This usually happens over a period of months. Hence, it can accurately give us clinicians an accurate picture of your blood sugar levels over 3 months. So, there is really no point in trying to cheat your doctor by abstaining from sweet foods 1 to 2 days prior to your appointment, because trust me when I say, we know. What about prediabetes? Prediabetes is when your blood sugar levels are too high but not high enough to be called diabetes. The precise definition is when overnight fasting blood sugar levels range from 100 to 125 mg per deciliter or 5.6 to 7.0 millimole per liter. This is also known as impaired fasting glucose. Or, in a 2-hour post-oral glucose tolerance test, blood sugar levels range from 140 to 199 mg per deciliter or 7.8 to 11.0 millimole per liter, otherwise known as impaired glucose tolerance. Prediabetes is usually asymptomatic, which means you'll never know you even have diabetes unless and until you have a blood test done. The good news is that if you have prediabetes, you can prevent or delay the onset of full-blown type 2 diabetes by making some lifestyle or diet changes. Speaking of diet changes, I'll leave a link here to my previous video where I talk about what foods you should eat to prevent a sudden spike of insulin to prevent prediabetes. Feel free to check it out. To understand diabetes, let me first introduce you to a cute little organ in our body known as the pancreas, whose job is to secrete insulin. Insulin is important as it binds to cells in our liver, muscle, and fat to take in glucose from the blood to utilize it as energy. Insulin resistance happens when these cells are not able to take up glucose from our blood, causing an increase of sugar in our blood, hence causing all kinds of symptoms and complications. The difference between type 1 and type 2 diabetes is in type 1, your pancreas is unable to produce insulin, causing insulin deficiency, whereby in type 2, your pancreas produces insulin, but your cells are unable to utilize this insulin due to insulin resistance. Type 1 is more common in children and young adults, and type 2 is more common in adults, especially those who are obese or have a strong family history of diabetes. The classical symptoms of diabetes we all learn during med school that is common to both men and women is the triad of polydipsia, polyuria, and polyphagia. Polydipsia, or increased thirst, is due to high blood glucose that raises the osmolarity of blood and makes it more concentrated. Polyuria, or increased frequency of urination, is due to excess fluid intake and glucose-induced urination. Polyphagia, or increased hunger, is due to loss or excess glucose in urine that leads the body to crave for more glucose. Other common symptoms are weight loss or gain, fatigue, blurred vision, slow healing wounds, frequent skin and fungal infections, darkening of skin in areas of body creases like armpits or neck, commonly known as acanthosis nigricans, and tingling and numbness in the hands or feet. Symptoms that are unique to men include erectile dysfunction or impotence, retrograde ejaculation, decreased sex drive or libido, and sexual dysfunction. Symptoms that are unique to women include number 1, vaginal yeast infection or vaginal thrush. When an infection develops in the vaginal area, symptoms include itching, soreness, vaginal discharge, dyspareunia, which means painful sexual intercourse. Number 2, urinary infections. The risk of a urinary tract infections, also known as UTI, is higher in women who have diabetes. UTIs develop when bacteria enter the urinary tract. These infections can cause painful urination, burning sensation, bloody or cloudy urine. There is also always risk of kidney infection if these symptoms aren't treated properly. Number 3, polycystic ovary syndrome. This syndrome is commonly associated with obesity and insulin resistance in women. Hence, they are prone to develop diabetes. Common symptoms include irregular periods, weight gain, acne, male pattern hair loss, and infertility. When an ultrasound of the pelvis is performed, one can visualize multiple cysts in the ovaries. So, this is it guys. Watch out for these common symptoms of diabetes and stay tuned for part 2 where I'll talk more about the complications to look out for in diabetics. Stay safe, stay healthy, and don't forget to click the like button, share, and subscribe.